Thank you everybody for coming out, or good morning, it's still morning, not noon yet. But thank you for coming out for the ribbon cutting for Boerne OBGYN. We'd like to thank you for being here in Boerne in our community. Definitely something we need here, and a lot of folks are excited as more of the facility gets filled up with some good services and doctors and things that we don't have to drive to San Antonio for. So I'd like to congratulate you on your ribbon cutting today. I appreciate you once again joining the chamber. Thank you. Appreciate it. Just in case some people don't know, let Doc tell us a little bit about what they do here and maybe introduce some of your staff.
Okay. I have two staff. They're Brooke and Megan, and they're both nurses, and one's answering the phone. I guess we officially work till about noon today, so we got to answer the phone for a little bit longer. But we basically opened March 1st of this year, and both Brooke and Megan are nurses. They live in the Bandera area. They drive over here. And we are open Monday, Tuesday, and Thursday in this building. This is a timeshare thing where Wednesday and Friday there's other doctors that actually practice here. And Wednesday and Fridays is when I tend to do hysterectomies, my inductions, C-sections, and elective GYN and various types of surgery and or deliveries I tend to do on Wednesday and Fridays, even though I delivered a baby last night, which that kind of happens too. But,
what was that baby thinking?
He waited long enough.
He did. But anyway, you know, prior to this point, Megan and me both worked some in the Kerrville area over 20 years, and for multiple reasons, you know, every time I drove by Boerne, I was always amazed that there wasn't an OBGYN in Boerne, and there's 5 pediatricians here, several family practitioners, lots of demand, and I think that, you know, one of the reasons I joined the chamber is one of the challenges I think that's a little unique to Boerne as opposed to other communities is there's not a hospital here where all the doctors congregate. So it's been a little bit more effort to go to various doctors' offices, and it's kind of hard as a physician does it typically. I don't know that I know there's a fair amount of participation of the physicians in the Boerne area in the chamber, which is much more so than from Kerrville, as an example. So I think it's overall, I don't know that doctors are as actively involved in chamber functions because I don't know that it's the traditional kind of business model where you get, but it's like anything else, you have to get your work, you know, get your name out there, get people to know you're here, and that's been, you know, Cammie, who works with Methodist, and Jody, they've been both very, very helpful at kind of introducing me to various other doctors and kind of helping me, you know, find this building and to find, you know, ways of making this all work out. But so far, as you know, we've gotten progressively busier and busier, and I think Boerne definitely has an untapped market, and it makes some of the doctors in San Antonio kind of nervous when they heard that I was setting up in Boerne, because I think they're already getting a lot of the transfers. I think the biggest advantage we offer over, I think, the San Antonio physicians are, particularly an OB patient, they're able to come here. If they're a school teacher, they can come here at 4 o'clock. They don't have to take off any work. They can be seen, go home in 15, 20 minutes and not have to drive a dozen times to and from San Antonio for a 15-minute fetal heart tones, tummy check, blood pressure check, and that's so I think OB-wise, it's kind of be, I think, a real nice thing for people to be able to have their OB services here and still deliver at a premium, one of the best hospital systems in San Antonio area. So it's been kind of, for me, it's kind of the best of both worlds. I kind of like living in a smaller town, but I also like being able to practice state-of-the-art medicine with a neonatal intensive care unit and having all the luxuries, because OB-wise, you really need to have all that stuff at the delivery. You don't need to have all that for all the antepartum visits, if that makes sense. So, you know, for overall, it's been something that I've been thinking about for years, and, you know, I'm looking forward to continuing to hopefully bring another person in. You know, my idea is that it'd be nice to have another OB-GYN. One of us would stay in the office, would have a full-time office Monday through Friday. We'd have one person that basically would be covering labor and delivery, covering the hospital, and then one person that would be office-based, and we'd just flip-flop that day to day. And that's kind of the way things worked in Kerrville when I set that up. OB-GYNs in general work better in groups than they do as individuals. So this is kind of a little bit of a challenge to make this all work until we can, but hopefully Methodist will build their outpatient center, will build their hospital in the near future, and that'll make the whole dynamics of my job easier, because I'll be able to have somebody that's in labor and still be able to see patients, where right now it's a little bit of a juggling act. But anyway, I appreciate all of y'all's support. I really was, you know, from the chamber, I've been to 3 or 4 chamber mixers, and I've been to some of the breakfasts, and I think as far as the participation in the chamber, I'm very impressed. I think Boerne's got a very active, vibrant chamber. I think that there's a lot of young, healthy people here, and I think it's all kind of invigorating to me after leaving a retirement town where there's just no industry in Kerrville, and Boerne's just surprising me how much growth and positivity and positive energy. There's just don't see that at all, and that's been a pleasant surprise.
That's good.
But if y'all have any questions, feel free to at any time to call me or Megan or Brooke, and we're happy to answer any questions. We are happy. We have plenty of business cards. Anybody that ever wants business cards, come by. Feel happy to tell us about your businesses, because I want hopefully we can strengthen the whole medical community, and I think medical communities are going to be important before the Methodist or another hospital system really wants to make the investment. I think they need to have enough primary care base to really make a hospital work. And OBGYNs are still considered by a lot of people to be primary care based, because a lot of females will go to their OB-GYN for annual checkups, and they don't really have other doctors. So I think you're kind of OB-GYNs in general have kind of a mix of primary care. There's obviously the gynecology, then there's obstetrical. So it's a kind of a blend of a lot of different things. But I think every hospital has to have pretty much a women's health department, and I'm hoping to be the beginning of bringing 1 or 2 or 3 more OB-GYNs here, where everybody can not only get antepartum care here, but also deliver here, and also have their hysterectomies here, and also have outpatient tubal ligations or whatever, everything done here, so they don't have to travel to and from San Antonio. So I think Boerne's a great town. The chamber's been very supportive, and I look forward to interacting more. I'll try to the chamber meetings on Thursdays I don't always make, because that's one of our busier days. But my intention is to make more and more chamber meetings, just to get to know everybody more on a personal basis than just because right now everybody's got their nice name tags on, but that's good. But I appreciate y'all showing up, because I know y'all have other things to do during your day, and it's it's nice to see the support within the Boerne area, and I appreciate it.
Absolutely.
Well, congratulations once again. What we're going to do now is let the folks who came out to support you, let you know who they are and who they're with.
Great.
And once we do that, we'll go downstairs and do the ribbon cutting. So we'll start with Cammie here.
I'm Cammie Sitter, physician representative for Methodist Women's Services in the Medical Center.
Jody Carestas. I'm one of the board members for the chamber, and I work for Methodist, and I have the oncology product line for the whole system.
I'm MJ Slater with GVTC, and we're so proud that you're a member of the chamber and that you have brought this very, very important entity to Boerne. And as you can look around, there's a lot of potential clients here, including myself. So, and I'm also proud to serve as one of your board of directors for the chamber. So welcome.
Great. Thank you.
I'm Terry Paletti, and I'm membership director at the chamber.
I'm Roseanne Hernandez with United SA Federal Credit Union, also an ambassador with the chamber.
Matt Stackhouse, ABC Home and Commercial, and one of the few males that showed up. So on behalf of the males, we want to let you know we like our women healthy. So.
I'm Teresa Harder with TNT Cleaning. Thank you. I've heard wonderful things about you, and the little one you delivered was part of our work family, so thank you.
I'm Kristen Baker. I'm with Salon Infusion. Fix anything you guys need.
I'm Zoe Turner with Salon Infusion.
Mary Sue Hart with the Boerne Chamber. I do programs and events, so we'll get you for the golf tournament.
Sounds good.
There you go.
I'm Sean Bonner with the Hungry Horse Restaurant and president of the Sunrise Rotary. Welcome.
Hi, I'm Carrie Phillip with the Boerne Banking Center. Oh, I'm Brooke with Boerne OB-GYN.
And I'm Megan.
All right. I'm Jacques DeBose with the City of Boerne and Heartland Payment Systems, and congratulations once again. We are glad you're here. And now we'll